think the
The general intent of the concept that was put in place in healthcare reform was eventually to move toward the idea that people could have options, including this type of option. In fact, when you talk to the people who were really the biggest proponents in the Senate, like Senator Conrad from North Dakota, this was really his idea in terms of where this would move forward as you got the exchanges, the health exchanges in place, where people could come in, have an option, and when Senator Conrad would be talking about this, he would say that the model that we have in the federal government is an ideal model to move towards. So that it's not off the table. Now, I can't answer a specific question about whether an individual out here could buy into that system, but excuse me. But eventually, over time, that was the notion that was behind that part of healthcare reform. Let me say just a couple of other things about where we are in this so-called repeal process and all the rest of that, because it's now probably going to be a vote in the House within the next day or two to repeal the whole package. I voted with the Republicans 17 times on healthcare reform. And those were not symbolic votes. They were areas where I believed that I personally need to lay down a marker in terms of how we can fix the system. I think what's going on right now is, this is a little bit away from your question, but I think it's important for people to understand. There's a lot of political payback to the people who elected this particular Republican Congress, that they're going to take this vote. Nobody believes really that health care reform writ large is going to be repealed. There are different portions of it that do need to be fixed, and that's where what I've been trying to say over the past several weeks is, all right, go ahead, get it out of your system, take the vote, it's not going to happen, and then let's get down and work together and govern and fix areas. For instance, the 1099 area where, I've voted already 3 times to repeal that part of healthcare reform. And Senator Baucus had some amendments on that. So my decision when the final vote occurred was, are we going to move forward, or are we going to continue the system that we have in place where so many people, for different reasons, are not either receiving care or being precluded from care because of pre-existing conditions and these sorts of things. And the need, from my view, is to move forward. And every time we do something like this in this country, there are people who believe the sky is going to fall. It's kind of ironic, when we were having this debate, I had good friends who, as I like to say, I got a lot of advice on this issue. I got 400,000 letters, calls, and emails. I considered all of the advice. I took some of it, but for those who believe I should go to hell for my vote, they're going to have to wait a while. But when I was looking, do we move forward, do we not? So some of my friends were sending me commercials that were run. It said, "Listen to Ronald Reagan," and I'm proud I served in the Reagan administration. Quite frankly, everybody here knows that. Ronald Reagan was making a commercial about the doom and gloom that was going to come from socialized medicine, and the commercial was from Medicare. At the same time, the Republicans who were putting this health care reform package together were the ones who were saying we need to preserve Medicare. So what we need to do is to find the areas in this very, very complex piece of legislation that are not going to work and do something about that, not just throw the whole thing out. And with respect to your specific proposal, as I said, that was one of the goals as we move forward toward these exchanges. That's probably the best way that I can answer the question.